Hello, everyone, and welcome to our first webinar of our fall free webinar series. It's wonderful. It's wonderful to be focusing on recovery this month, being September and National Recovery Month. So we're grateful to have Tim Rabolt, Executive Director of the Association of Recovery in Higher Education, today to be our presenter on our topic, Collegiate Recovery and Institutional Buy-in, Research Results and Returns. My name is Cindy, and I'm with the Higher Education Center, and we are grateful for all of you for joining us today. Before we get started and I hand things over to Tim, I want to provide you some housekeeping information. So here is how you can ask questions throughout the session. If you have any, we encourage you to send those through our question box on the control panel on the right-hand side. Tim will be answering those questions at the end of our session. There will also be some times where he engages you through the chat feature, which is also in that control panel on the right-hand side. So we encourage you to respond to his questions through the chat box versus the questions box. We also want you to learn more about the membership benefits available through the Higher Education Center. Membership benefits include access to our web-based screening, brief intervention, referral treatment program named Screen U, as well as access to our Recovery Ally training materials, our past and current learning collaboratives, and a discount to our upcoming national meeting happening in just 3 weeks. You can learn more about the Higher Education Center membership by visiting hecaod.osu.edu. And as I mentioned, the national meeting is right around the corner, 3 weeks here in Columbus, Ohio, October 15th through the 18th. Our focus this year is around implementing change in urgent times. Registration is still available for the conference. We're bringing together those of you working in collegiate prevention, intervention, and recovery across the country. So I encourage you to come and learn more about the work that is happening on campuses nationwide, share the work that's happening on your campus, and have the opportunity to learn from each other. You can learn more about the conference at go.osu.edu/NTLMTG18. And with that, it is my great honor and privilege to introduce to you Tim Rabolt, the Executive Director of the Association of Recovery in Higher Education. Tim, thank you so much for joining us today.
Thanks, Cindy, and thanks to the whole Higher Ed Center for putting this webinar series together and inviting me to speak. I'm definitely glad to be here. I was going to start with a joke about my my headshot, but remembering that it's a webinar and I won't be able to hear anyone laughing, I'm going to skip right ahead and avoid that awkwardness. So jumping right in, let's see, to the agenda. So I'm going to kind of start off with just some background information kind of about myself, just so you all have a sense of kind of the perspective and lens I'm coming to this discussion with. Then I'm kind of jump into some of the basics around collegiate recovery. I'm kind of guessing that we have most of the attendees somewhat familiar with collegiate recovery programs and communities, but we also have a slide to hear from everybody through that chat box feature that Cindy was mentioning about, you know, what organizations you're representing, what your level of familiarity is with collegiate recovery, and kind of what you're hoping to get out of this session. Then I'm going to jump into a bit of the research around collegiate recovery, particularly the studies that I've found really helpful when I was at George Washington University, studies and data that helped me kind of translate to our administration just how effective collegiate recovery is in promoting, you know, holistic student success. And, you know, that was some of the information that we really capitalized on to, you know, get the ball rolling in terms of, you know, developing a program and securing all the aspects that we needed. And then kind of the big question that doesn't really have a solid answer, but I have some slides to go over about really like what's the return. I'll go into it in a slide or two, but I came up through business school, and, you know, we got, you know, ROI hammered in, you know, every you know, different kind of class that we took. And so, you know, knowing that sometimes you need the, you know, top level administrators to buy into, you know, a new program, especially when there's funding attached to it, trying to answer that overall question about, you know, what is the return, you know, on the investment for the institution to buy into collegiate recovery. And then just a couple of slides about some next steps and events and resources to get plugged into, like the Higher Ed Center and the national meeting that that Cindy was just mentioning. All right, the bar. Okay, there we go. Just clicking moves it along. All right, so just some background about me. Like I said, I think it will just help to kind of inform you all about the lens and perspective I'm kind of coming to the discussion with. So I got into recovery in high school. I grew up in Wilmington, Delaware, right outside of Philly. And, I finished off high school and I came down to George Washington University in DC and just expected to be met by hundreds of students in recovery, just waiting for me. And needless to say, that didn't really happen. And so I got there and found a couple administrators who were working in health and wellness and student judicial services, and folks that I thought might be able to point me to where all these students in recovery were hiding. And I told them I was in recovery and I was looking for meetings on campus and how to get plugged in. And they kind of looked at me like I had three heads, and that was when I kind of realized it was going to be a battle to get things where I needed them, where I felt comfortable kind of staying in school. So like I mentioned, I was in the business school. I actually studied sports business. I was planning on working for either a sports team or a sports league, and it was kind of funny. It was actually right after the national meeting, maybe like 4 years ago, when I was in my senior year, and it might have been called like the Generation RX Summit at that point, or it was something different. But I remember coming back from that conference and then realizing like, okay, like I'm heading into senior year, and I actually want to completely abandon everything about sports and go into collegiate recovery. And I called Sarah Nerad, who used to work at the Higher Ed Center, and like kind of had a breakdown, and she, kind of guided me through the process to pivot and go into grad school. And, so I studied higher ed administration at GW in the student affairs track, and got an internship at the White House under Obama and Michael Botticelli, and got more plugged in with ARHE and kind of, made that pivot. The past couple of years, I worked for a public health research and consulting firm called Altarum, which is in the DC area, as I was finishing up grad school. And then I've been full-time with ARHE the past 6 months, and just in the executive director role, I guess, since early July. So still kind of, getting things all figured out. So with ARHE, we briefly mentioned them, but ARHE is the Association of Recovery and Higher Education. It actually used to be a part of the Association of Recovery Schools, and then kind of split off once, it was clear that collegiate recovery was growing so quickly that it, could handle its kind of own central organization. So we are a nonprofit membership association. We represent, students and staff and programs across the country. We're still small and kind of in that startup nonprofit phase, but there's been already a lot of history with the association being started about seven years ago, and largely relying on a volunteer board of directors, which has been elected by membership, and it's been program directors across the country who have really kept it going and kind of turned it into what it is today, and helping kind of shape the field and continue this growth that ARHE, as well as Transforming Youth Recovery and all the different schools around the country, have kind of helped progress the movement as a whole. So the mission really is to empower the programs to and the professionals to support students who are in recovery. And the kind of vision is that broad vision of seeing a program on every college campus in the country, and hopefully at some point throughout the world as well. We're kind of seeing Canada get on board, the UK, so it's only a matter of time until we see that like fully developed as well. So this was the part where I'm relying on you guys to use the chat feature. We had the option of doing the poll, but we're hoping that some of you would be willing to kind of introduce yourselves through the chat feature, just to see who's kind of on the webinar today. So seeing what schools and organizations are represented, the role you play either at your school or within the organization, kind of level of familiarity with collegiate recovery, and then why you're attending the webinar today. I did this similar presentation here at NASPA back in the spring, so obviously it's a little different when you have people in the room. But just wanted to get you guys to kind of introduce yourselves and see, where in the country you are and what your kind of role is and things like that. So I'm not seeing too many, so we'll go on and I'll kind of see as they're popping up. Cindy, is it just the chat feature I'll see kind of on the home screen?
That's right. So should be a chat box at the bottom of your control panel that you can enter dialogue into, and you can set it so that everyone can see that. Rather than the
Gotcha.
questions box. So if you send it in the question box, only myself will be able to see that. But if you enter in the chat box, everyone will be able to.
Gotcha. Cool. Thanks for the info, Cindy. We'll kind of move along and see as people are joining and getting more comfortable or finishing up lunch if they're able to use that feature and see who's on. So moving right along. Okay. Yeah, so this is kind of some of the basic collegiate recovery info. Like I said, I'm going to go ahead and assume that most folks on the webinar have a basic kind of understanding of collegiate recovery. But kind of what we're talking about when we say collegiate recovery programs, and you'll see the acronym CRPs all over the place as well as CRCs. But we're really talking about university-provided addiction recovery support services, at least throughout my presentation, as we're kind of talking about collegiate recovery over and over again. And the reason that it's important to kind of point that out is as the field kind of grows, and this kind of ties into the recovery field overall, but there's more and more organizations are getting into this space, and you'll kind of see it with treatment too, where there'll be treatment centers who say like, well, we have college students here and they're starting their recovery and we're helping them in their recovery, so that's collegiate recovery. And that's it's not the case. And so we're really set on kind of having that definition be clear that it's the college and university that's providing the support service for the students, and that's what we're talking about. It's not these outside entities, and some of that additional info you can kind of see up on our website, and we're in the process of kind of making it stand out more and getting it updated as well. So Tom Kimball, who's the president of our board, and he's the director down at Texas Tech in Lubbock, he'll always kind of equate it to the services similar to the accommodations that collegiate athletes serve. And there's a couple of times throughout the webinar today that I'm going to, kind of tie it back to sports, just because, like I mentioned, I went through, the sports business program, and sometimes the analogies are easier for me to see that way. And as well as talking to some other folks, whether they're high up in higher education or in other, aspects of higher ed, sometimes being able to equate it to something, similar in terms of kind of like the structure or the services offered, helps them understand kind of what we're going for. So, like I mentioned, Texas Tech, and there's, a host of other programs that have been around for a while, like Texas Tech and Rutgers, they're at decades at this point, like 30 years, and obviously Brown started in the 70s. I'm here in Minneapolis, and Augsburg University has been around, I guess, for nearly 20 years, and then I'm going to have the chance to visit Kennesaw State University tomorrow down in Georgia. They're really interesting, and I'm going to mention them, I guess, again in a couple slides about how their approach has really evolved and gotten them to have roots kind of in like the overall university culture. So they're a really interesting kind of case study. So the typical kind of components within a collegiate recovery program, I'm sure a lot of you guys are familiar with it, but having meeting space for the students, the dedicated staff, the support services, housing accommodations, things like that. One thing we're realizing more and more is there's kind of like as many pathways of recovery there are for individuals like seeking recovery. It's also the same kind of thing with a collegiate recovery program. I think we're finally seeing institutions and even our members go outside the box a little bit and realize that there isn't exactly like a cookie cutter solution that'll work on every campus, because every campus is different, in terms of like the geographic location and the demographic makeup of the students and different aspects of the campus. It's very different. So I think a lot of schools have had success kind of trying to replicate what Texas Tech has done, and other schools have pivoted away from that. And there's a variety of different ways to develop your program. And kind of that last bullet point too, they're housed in a variety of different areas. A lot of times it'll be in health and wellness somewhere and student affairs, but in Texas Tech's case, they're housed academically. So there's a variety of different ways for the program to grow and develop and flourish. So moving on with so I was going to just jump in quickly. I kind of threw this in there last second, but I know that the funding piece comes up over and over again, and this is another piece where I don't think it's really black and white. I think one of the themes and kind of takeaways that I would push forward from this presentation is almost like embrace the gray area, and if you are thinking things are completely black and white, like if you don't have it this way, then you can't have it at all. It's not necessarily the case. There's a variety of different ways to kind of approach this thing. So with Texas Tech's case, I think that's obviously the ideal with their funding structure. The entire program is endowed. So Kitty Harris and a lot of the folks that have been there from the start have done an incredible job throughout Lubbock and Texas, and really throughout the country in getting not just obviously institutional buy-in, but getting buy-in from philanthropists and organizations throughout the country where they're able to fully endow their programs, so they don't have to necessarily worry as much of that institutional buy-in piece that I'll get into in a couple bullet points, because they're going to have their funding. With Kennesaw State, what I was mentioning, and Lindsay Montgomery from Kennesaw State did this presentation at our conference in July around recovery-informed education as a means for institutional sustainability, something like that. And basically what she did and what Kennesaw did was, go beyond just supporting students in recovery and kind of, have some stake in like the prevention side of things and other aspects of, the AOD work on campus, and even broader than that, to the point where they're so woven into the fabric of student affairs and that work that it's kind of becoming part of the culture. So Kennesaw's case, they've had a number of different presidents come in, but the CRC and the center continues to grow. And kind of this is almost like the opposite for the next point around GW where I went. We took this approach where it was really bottom up, and it was kind of student-led initiative to secure space and the housing accommodations and get funding, and we got our staff member, and now we have an entirely new administration, and there's some worry that it's not going to last. And I think that's kind of the danger, when we talk about institutional buy-in and being institutionalized, it goes back to the same thing. I don't think it's black and white. It looks a lot of different ways, and we felt pretty strongly like we got institutional buy-in, but now most of the folks from the institution that were our allies and advocates aren't there anymore, just a few short years later. And so we're going to see what kind of happens from that point on with the new administration in place. University of Utah was really interesting. If you guys saw what happened there maybe like 6 months ago or a year ago, they actually advocated on a higher level to the state, and they got a line item within the state funding for maybe like $100,000 a year to fund the staff member and maybe a little bit of a program budget for the Collegiate recovery program there. And then the University of North Texas, they took the approach of adding it onto the student fee, so they got the funding that way. So there's so many different ways to do it. I think a lot of folks might get too overwhelmed thinking of overall endowment, like in the case of Texas Tech, and just kind of throwing it out that there's a lot of different ways to do it. And I think all of us are pretty fortunate to have universities with development teams and universities with a long-standing history and that have a lot of stakeholders, right? If you're looking at parents and alumni and everyone else, there's a lot of folks to tap into to kind of help with that sustainability piece. So this slide I borrowed from EverFi. I just thought it was really great, kind of tying back to the thing I was just talking about with Kennesaw State, by kind of looking at it at this broader lens, like the social justice aspect of it, the reputation aspect of it, and then student success, as I was kind of hinting on a bit. I think this is a really interesting approach to take with university administrators, especially as all three of these are kind of at the forefront of what student affairs and higher ed in general are kind of, focused on. Social justice, the reputation piece always, and student success. It's, I think I threw it up here to get folks thinking about different ways to pitch collegiate recovery to either your administration or to folks in your community. I'll obviously go into some of the research and the numbers a bit, which I found helpful, but there's a lot of different ways to spin it. And, one of the things I'm kind of grateful for when in business school is to realize that you can't just kind of say the same thing to everyone. Everyone has a different kind of perspective or a different set of needs or, background, where it's kind of important to, put it into focus for them and see how it, stands out and make it important for them if it doesn't seem like it is kind of initially. So with this, I do feel like I'm talking about tech a lot. This is, like I mentioned, this presentation I did back in the spring at NASPA, and they just had a lot of great stuff to kind of, give examples to some folks who weren't as familiar with collegiate recovery. So another thing that Tom would always say Tom Kimball from Texas Tech, every time he's presenting, is that he would, put his group of students up against anyone else in the country as far as like these student success metrics. And, they have the data to prove it here. They're looking at like the graduation rates, the higher GPAs, and that's kind of what we're going to tap into in the next few slides on a national scale, is just how successful students in recovery really are, and using that as a way to advocate for more funding or for more support. And that kind of, ties into the, the title of the presentation about, the research results and returns, and kind of getting into those details around this on a larger level. So before kind of jumping into this too much with the research piece of it, I do want to say as well, because we're seeing more and more research come out from, different schools. TYR, Transforming Youth Recovery, had the census come out, and Tom Kimball and Robert Ashford and Austin Brown are doing incredible stuff, and started the Journal of Recovery Science. So there is more and more, but something that was eye-opening for me, last month I was in DC at the Substance Abuse and Mental Health Services Administration, and they convened kind of all these leaders from the different areas of recovery support. So there's, recovery housing and recovery community organizations, and they had the Recovery Research Institute there, who's part of Harvard. So it's Dr. John Kelly and his team, and they did this comprehensive literature review of these different areas. And when it came to collegiate recovery, I didn't think we had, decades upon decades of research that's, undoubtedly proven the efficacy of collegiate recovery, but I also didn't think we were in a bad space. But, kind of the results from his literature review is, the quantity and the quality of the research out there was pretty low. And that's not to say that, every school shouldn't be using the data that is out there, but it was just kind of eye-opening in the sense that we have a lot more work to do. Because I think a lot of folks working in collegiate recovery and some of their schools, like they know it works, they can see it, but there is a lot more progress that we do need to make on the research front. So this part was helpful for me when we first started years ago, and I remember seeing this. It might have actually been at the national meeting where I first saw this, like 4 years ago. So, it talks about like the average university of 30,000 students, which I was just looking up Ohio State as a reference point, like just the Columbus campus is like double this. And, they have these different metrics around number of students, meeting the criteria for so-and-so. But that last one was really eye-opening for us, just about even if it's 1.5%, which might be a small number, putting it into terms of actually how many students they found or meeting the criteria for just for seeking help, right? So if you're looking at this for Ohio State, that's nearly possibly 1,000 students, and unfortunately, a lot of them are falling through the cracks. I remember one of the most difficult things at GW was how many students we had come to our meetings and then they had to leave the school because it was already too late. Like we didn't catch them in time, and we were just a student group, and that was so difficult to see students having to leave because of academic or financial problems, or just needing to go to treatment and not being able to return to school. So just to put that into perspective around like the sheer kind of quantity of students that we're really talking about. So this survey, I'm sure a lot of you guys have heard about it, but it was the first national collegiate recovery survey done by Dr. Alexandra Lede back in 2015. So she looked at 30 schools, around 500 students, and we'll jump into the student success metrics in a minute, but I think the finding here that isn't talked about enough, especially in translation to what this means for a school, is that the students who are in collegiate recovery programs compared to the average kind of addiction life cycle, they had that 15-year reduction. So they were getting into stable recovery 15 years earlier. So just to think about, what that 15 years would look like. Obviously they're not going to be a college student for those 15 years, but I imagine that most universities, put a pretty big emphasis and priority on alumni engagement for a number of reasons. One, for donations and for involvement in supporting like their current students, but also hoping that maybe they'll send their kids there someday. And to just look at that drastic change you have, 15 years, like that's pretty significant to have, that level of reduction, with the support that's found in a collegiate recovery program. So when I heard this, I think this is Dr. Lede presented this actually here in Minnesota for the first time, at it might have been the 5th National Collegiate Recovery Conference. But I always will go back to this, and this is what we kind of hammered into our administrators every time we got a chance to meet with the dean or with the president or with board of trustee members. We had, it wasn't a case statement. It was kind of like a one pager. I forget the name we had for it, but it had some of this data and the quotes from students and all sorts of stuff, and we brought that everywhere to get the buy-in. But looking at the year-to-year retention rate institution versus the CRP, over 90%. I think it was the 4-year graduation rate average for the institution was closer to 60%, but nearly 90% for students who are in a collegiate recovery program. I mean, that level of progression has to speak to administrators. And then if you can tie it back to, I think the thing that always happens is, they'll ask, well, how many students are we really talking about? Like 10, 20, 30 students. Well, you can point to some of these programs that have, 100 plus students involved, and you can even point to some of these earlier programs who are kind of developing, and they hit this threshold. I was talking to, I was out in Colorado and visiting with CU Boulder and seeing how many students they have involved just in year like 5 at this point, and even with VCU down in Virginia, same kind of thing. There's this like threshold after a certain amount of time, like it really starts to take off, and I think we're just kind of at the surface level for all this stuff here. And then the involvement piece, I think that was looking at actually community involvement, hours per semester, so you can see just how engaged these students are on campus with service and giving back and supporting different aspects of the university. So it's really kind of building the model student, which we'll jump into in a slide or two here. I'll also try and wrap up in the next 10 or 15 minutes or so we can leave enough time for questions. GPA, obviously another piece of the student success factor, showing how much better the students in the collegiate recovery programs are doing compared to their counterparts, the other peers at the university. All this kind of put together really, I think, captures just the power of collegiate recovery and, what these students are capable of if they're supported the right way. So this was put together by Robert Ashford and Austin Brown and some other folks from Kennesaw and around the country, I believe, to capture the alumni side of things. We're just talking about what the students are looking like, but even alumni. I mean, look at some of these numbers up top. 97%, so almost all of them are still in recovery. About 90% believe their program helped their academic success. 70% believe their CRP prepared them for professional life. 80% believe their CRP prepared them for post-grad recovery. That's incredible. That's an incredible testimony to the long-lasting impact of a collegiate recovery program. And it's not just a support service in isolation, right? Like I would always talk about when I was a student and I'd go see a counselor, right? We'd have like 50-minute sessions and we could have a certain number of them for free, and we could only see the counselor once a week. So, we had 50 minutes once a week, and then we had, 6 days and 23 hours to figure out where else we're getting support. But with a, collegiate recovery program, they're getting this wraparound service that's, supporting them in all sorts of different ways, and it's long lasting, clearly demonstrated by some of the data they got here. So it's great to see. So kind of jumping into the big question on really what's the return here. It'll go back to the same thing. It's not really black and white. It is more gray. But kind of recapping some of the stuff we know the CRPs are leading to more successful students with all those student success metrics around GPAs, graduation retention. There's high percentages from the alumni saying that the CRP helped them, with academic success and for professional life. We're knowing that CRPs are leading to healthier, more engaged students. Going back to that piece around reducing the addiction life cycle by 15 years, and 97% are still in recovery, and all that community kind of engagement on campus. Additionally, so this is kind of tying into like what's this looking like for the college or university. So if they're having healthier students, that's going to mean that there's going to be less problems, which will translate to them being less cost. This is kind of trying to put it in the financial perspective to them. I would hope that a lot of times, if folks are getting the right people in the room from the university, that they don't have to just make it around numbers, but at least in my experience, a lot of the time that does come up. I think if it was just based on doing the right thing, we'd see even more collegiate recovery programs than we do. But I think the trouble is finding the funding and resources to be able to have staff and get everything kind of in place. So moving on, we know that the students would be more engaged, which, like I mentioned, turns into more engaged alumni, which the school will hopefully see as potential donors. One piece I was just talking to someone about last week, it might have been out in Colorado. It was actually University of Denver. They've really gotten total institutional buy-in. They have a great space, like an actual house on campus, and funding for a couple staff members. And this is like their first semester. And one case that they made, that the two folks I was talking to, they both have the higher ed background as well for their masters. I think both actually went to Ohio State as well. They were kind of talking about this completely untapped donor base for the school, which is a completely valid way to get the buy-in, because at George Washington, for example, like we would meet people in the community that had no level of engagement with the university, but they were in recovery, and when they found out what we were doing, all of a sudden they wanted to do anything they could to help out, including making a donation, because they just it would be something along the lines of, wow, I wish I had that when I was there, or wow, I can't believe I can't even imagine what my experience would have been like if I had that level of support. And I think that's a completely understated kind of way of approaching administrators to get the buy-in on a larger level. And then also this last piece around student success being a great business practice for the school. It's I heard it so much through my master's program, and it makes sense that schools would focus on student success, obviously, but there's also this underlying business case for it too. I mean, the students are staying in school, so they're paying tuition, they're buying textbooks, they're supporting all the different on-campus um, businesses, they're paying for housing. If those students become alumni, it helps with the prestige, the rankings, and then that untapped donor base that I talked about. So they really have a strong business case for developing a collegiate recovery program as well. Yeah, this is kind of what I was going back to on one of the previous slides, is that it really is kind of looking like a collegiate recovery program is molding the ideal kind of college student. I mean, what university wouldn't want a student that's healthy, has high life satisfaction, they're engaged, they're giving back, they're doing well academically, professionally, personally. It really kind of hits on all these different aspects of overall success and satisfaction that a university should want to see. But like everything else, we're kind of competing with other groups and other needs and hot topics, and when it comes down to funding, that's usually the piece that causes kind of the biggest holdup. So, like I said, what's the return? There's not really an easy answer. It depends on so many factors around, the size of your school, where you're located, kind of how far along are the efforts on the campus. Is it, just a couple meetings, or there's housing and some students, but there's no staff. There's all sorts of different points that a school could be at. Depends on, how well the school's kind of, or the program's tracking outcomes and being able to utilize that to kind of get further buy-in. Lots of different pieces that kind of go into determining this answer. Like I said here, if there's, if someone had some 100% accurate calculation, I know there's a lot of different things out there, tools to, calculate different pieces, like what is drug and alcohol use costing the school, or what are some of the benefits of having a CRP financially. But if there was a some tool that's completely accurate, that person deserves the Nobel Prize, because I think that would send this field into kind of overdrive, and you see programs on every college campus if we could really accurately get that. But some of the first steps, I think, is really kind of diving more into the data. I mean, I barely even scratched the surface. There's a few literature reviews out there, and it's easy to kind of pull up some of these different articles and research studies that kind of capture the benefits from individual schools or on a larger scale around collegiate recovery. And then kind of, like I mentioned on that previous, take into consideration some of the unique circumstances that your university's in. And then it kind of comes down to what I was saying is, you might not really need to answer it exactly, because the, can administration really put that price on, risking another student death? And, hopefully your universities haven't experienced that, but I know the pretty high number that unfortunately have had to experience that, student overdose death or something traced back to drug and alcohol use. So that versus promoting holistic student success and that, overall kind of push towards student wellness that we're seeing throughout higher education, I think that alone should be able to push most administrations into buying into collegiate recovery. But again, the funding piece is kind of where it gets held up a bit too. So as far as kind of next steps, there's a lot of organizations out there. I think talking to the schools specifically is some of the best kind of approaches to get more involved. So you can visit ARHE's website. Transforming Youth Recovery is another national organization that's done a tremendous amount of work supporting the movement. The Higher Ed Center, their listserv is always packed with different resources and questions, and on their website has a lot of great facts and information as well. The national meeting coming up, like Cindy said, and then talking to a lot of the schools, on the national scale, but also kind of in your region. And if you go to the ARHE website, you can get plugged in with your regional representative who can connect you with schools nearby, or kind of just be a resource on their own. We do have our national conference coming up next summer. You can go to the website. Sorry, this got cut off a little bit, but we do our conference with a couple of the other recovery associations, but we'll be up in Boston in what is it, 8 or 9 months from now. So you can mark your calendars for that. And there's all sorts of other stuff that's popping up. Like I mentioned, the national meeting. There's the Mid-Atlantic Collegiate Recovery Conference coming up real soon. I guess like next weekend already, down in Greensboro. The NASPA conferences, and then just one plug about our new Leadership Academy. So if you guys don't know what that is, we're partnering with another nonprofit called Safe Project, and we're launching our Collegiate Recovery Leadership Academy for students. They don't even have to be in recovery, but the kind of goal is to get the students involved with collegiate recovery on a larger scale. So they'll be in a year-long program, working with a mentor and working with some of the academy staff. They'll be working on what we're calling a collegiate recovery impact project, which will support collegiate recovery on a local level, national level. It's kind of really up to the student. We kind of help guide them through that process. And then they get a scholarship to attend our national conference, as well as a scholarship to attend one of our regional summits that we kind of outline here. So that information can also be found on the website, collegiaterecovery.org/academy. There's no cost at all to being in the academy. And then the application deadline for the students is today. But these regional summits are open to the public. So you can find that info online. We're still kind of getting everything developed. And as I mentioned, there's schools that are doing, things on local levels, regional levels, and, it might not always be possible to travel and, get the time to do it, but I've always found it's really helpful to see people face to face and kind of connect around, what's going on. So a lot of references. I'll kind of just move through those so we have some time for questions at the end. But thank you guys. It was great to talk to you for the last 40 minutes, and here to hang around for any questions that folks might have.
Well, thank you so much once again, Tim, for sharing your knowledge and expertise around collegiate recovery with all of us. Now is the time for questions. If you have any, you can enter them into your question box. We've been sharing the feedback that you provided earlier about who you are and what you're doing as it relates to collegiate recovery with Tim through the chat box, and so he's been able to take a look at that as they've been coming in. So thank you for that. But if you have any questions, now's the time to send them our way through that question box. While we're waiting for those, I just wanted to let you know about a couple of the things happening here at the center. We are just recently launched our latest learning collaborative around engaging peers in prevention, intervention, and recovery work on campus. And so we have 6 webinars happening. 2 of them have already happened and have been recorded and archived on our member portal, but it's not too late to join us for the last 4, including our next one coming up on October 10th, which will focus on strategies for working effectively with Greek-affiliated students, gaining access, getting buy-in, and building rapport with Stephanie Gallia from San Diego State University. So if you want more information about learning collaboratives, you can visit go.osu.edu/engaging peers. This is a free service for our Higher Education Center members. Those of you that are not members can join the Learning Collaborative for only $100. Additionally, our next free webinar is coming up October 25th, featuring Eric Davidson, the Executive Director of the Illinois Higher Education Center, and he'll be focusing on drug-free schools and Campus Act regulations, an overview and update. So if you're a campus that's working on your biennial review this year, you won't want to miss this webinar. You can register for it at go.osu.edu/OCT webinar. And we do have some questions coming in. A common question is if we'll be providing a copy of the presentation. Our webinar has been recorded and it will be archived on our website and YouTube page within the next 3 business days. And we'll also provide a PDF handout of the slides for you to refer back to as well. So a couple questions for you now, Tim. What methods have you used to recruit students to participate in the creation of CRCs?
Oh yeah, that's a great question. So let's see. So I saw Katie Bean was actually on from St. Joe's. She was actually the first person when I was at GW. She was still there, and she was like the first person I ever told I was a student in recovery to. So it was cool to see that. But so it was actually Katie's counterpart, um, Tara, who also worked at GW. So this was, I'm kind of answering the question in a couple parts, but she helped because she worked in the judicial aspect of the university, and so she was already connecting with students in recovery who are looking for support. So if there's, I guess the answer for that piece is like if there's someone like a common denominator, like if there's students in recovery are struggling, where are they ending up, and catching them there and getting them plugged in. So that was their first step. Then the second step, I think we did a really good job with social media. I mean, we were all over Facebook and Twitter and later Instagram, but we were doing stuff constantly. We actually got a few students. Well, we got a lot of students to hear about us that way, and also some students to like directly like message us, and say like they're struggling, like when could they get to a meeting with us, something like that. So I think the social media piece is big, and I saw Jay from ECU is on, and he'll probably laugh at this too, but like they do such a good job with social media with his program, and this is kind of like the risk I think is that I think we did a really solid job with social media, and that's why it worked. But I can easily see a school maybe not like being on social media a bit, but not kind of posting in a way that resonates with students. I'm trying to say it the right way, like kind of not looking cool, and that might be a risk to exploring that route. So I would do getting a grad assistant or getting some help from Jay, or I think Mississippi State is also doing like really great content online. So there was that piece, and then we were just kind of like we showed up everywhere. Like we started a student org, and we were tabling at events. And we were we threw our own events. Like we threw this big thing called Recovery Day every spring, and we got all sorts of people to show up. It was also helpful like being in DC that we could show up to other events and kind of capture that. But we just kind of did as much as we can, and like I said, it was a little bit easier as a student group because I think we could kind of like make recovery look really cool and appealing and attract students that way. So I hope that helps a bit, but feel free to also send me an email, and I'm happy to chat with you offline about it.
Thanks. And kind of a follow-up to, as you were responding to that question, another one came in. You had mentioned some social media sites, and there was a question about which specific ones you're referencing when you say social media sites.
Oh, around. Okay. Well, I mean, Facebook's big. I don't know if it's as big now. I mean, I'm not 30 yet, but I don't know if Facebook is still big for college students who are just coming in. So I'm not entirely sure, but it seems like that's a pretty like a given. I think folks got to absolutely be on Instagram now. We did the most with Twitter. Um, I think it was actually, it was interesting, but our dean of students, he even did like a NASPA presentation on this, but he kind of created this whole culture around Twitter on our campus that folks, a lot of folks in student orgs were all over Twitter. I don't know if that's the case with other universities, but that was kind of our primary go-to. We're doing like Twitter chats and, tweeting at people and trying to get folks in departments to retweet different things we were putting out there. So that was a big aspect. We never jumped too much into Snapchat, and we're never on, LinkedIn or anything like that. So it was really kind of just those three.
Excellent. So we also have some questions around that kind of relate to funding and stakeholders. And so one person said that they oftentimes get the response that you're asking for a lot of money for just 9 students, which is their current membership,
Right.
but administrators often have a narrow vision of the larger impact. Tim, are you familiar with any research on the impact of collegiate recovery communities on prevention efforts or as a tool in intervention conversations with students who are misusing?
Not specifically, but that's really interesting. Actually, I think that Kennesaw State would be a good a good place to start with that. Actually, and if someone asked me that offline, I would probably even check out your guys' website too on the Higher Ed Center. It seems like something that might be there. Also, going back to like the literature review, I'm not sure if the one John Kelly and the Recovery Research Institute did is public, but I know the one that Robert Ashford and his team put together should be public. So I would kind of explore there. But that would be interesting to come across that. And it is tough. I think I was mentioning it, in the middle of the presentation, that it is tough to go ask for funding when the school will kind of see maybe 9-10 students involved, which is fantastic, but they will kind of say like, well, what about this group over here that has dozens more students and they're asking for less funding. It's frustrating to have to make that case, because we know how important it is and we know the need, and just what that kind of money will do to be able to support the students on another level. So I totally understand that that difficulty in making that happen.
Yeah, we know that research, although the body of research around collegiate recovery is certainly growing, it isn't obviously as plentiful as some of the prevention research that we have in the college space. The Higher Education Center writes briefs weekly in our U report that goes out, which is our free e-newsletter, but we store all of those briefs on our website, and we recently revamped the website on that specific page, making it easier to search. So those of you interested in recovery specific research, although it's certainly not all encompassing, as we write briefs specific to that, can find those on our website under the research page by searching collegiate recovery. So we encourage you to check that out and see if there's anything there that will meet your needs. We have another question around funding as well. And so previously, this person has used the 4-year cost of attendance of an out-of-state student, which for their institution is over $100,000, who did not choose a particular institution, to help convince administration to let them apply for a Transforming Youth Recovery grant, which they were able to get, but also to help justify having an on-campus AA meeting. Have you used the cost of attendance for students who have chosen not to attend because of a lack of on-campus resources?
Yeah, totally interesting. Yeah, so that's great. Like kind of like the opportunity cost thing. I was gonna jump into that because it's another kind of thing that was hammered into us in business school. But yeah, like that kind of lost cost, like the lost revenue for the school. That's great. I haven't seen that specifically in anything, but I know just in like conversations with our president at GW and with our some of the board of trustee members, like we've brought that up absolutely. I think Dr. Lode and maybe that survey of the alumni as well kind of had some of that data. It was definitely Dr. Lode's survey around the percentage of students who would say that said they were not, like they would not have come to that school, or they wouldn't still be enrolled if it weren't for a CRP. So they're, you're missing out. You're not just developing more successful and healthy and engaged students. You're missing out on those students if you don't have it. So I haven't seen specific numbers around it, but I think that's a great approach, especially if you are in conversations with someone who understands that concept of like lost revenue, like what the school is missing out on by not having a program like this.
Great. Tim, it looks like this is our final question for today. Who have been the most influential stakeholders that you meet with at schools in the early stages of creating CRCs, recognizing that all school dynamics are different?
Wow, yeah, that's a tough one. It's there's yeah. Sorry, I just needed a second to think about it because I was kind of racking my head on all the different people we met at when we were kind of running through things at George Washington. I guess we made sure to always keep the relationship going with the dean of students. It just seemed like he was that kind of liaison between doing what's right for students and also doing what's right for the university, kind of like on a business standpoint. But for us though, like we also, I guess it depends on the goals. Like if it's around funding, if it's around like growing the program or getting like students meetings. So it kind of depends on that, because for the student, like we were trying to do everything all at once, so we were just kind of running wild. But like for the student piece, for example, like we made sure that we had buy-in from, you know, some of the big student organizations on campus, and like the student government, the student body president, and similar student orgs that were focused on maybe mental health or um, sexual assault prevention, or things that were kind of, you know, closely related within health and wellness. So for the student piece, we focused on that. Then for the institutional buy-in component, to get it kind of more developed, it was all through student affairs. So we were talking to anyone we could, you know, within housing, within you know, just all these different kind of student affairs departments, to get them understanding what we were trying to do. And the funding piece is really tough, because, you know, with that, we were, you know, we were talking to the head of development for student affairs. We were, you know, digging up information on board of trustees members, and connecting with them directly, and bringing them to the Serenity Shack, which was our space on campus. And then, you know, this is not something I would recommend, but, you know, we were students at the time, so it's a little bit different. But we, you know, we wrote this letter to our president, and got all these signatures, got like a couple hundred signatures within like a week or two, almost demanding staff. And, you know, that got us like a 2-hour meeting with the president, which was more than we've gotten in the past like 5 years combined. So it's not an easy answer, because it depends on the goals and everything. But I guess I would kind of answer it by saying, like, I wouldn't discount anyone. Like, I think everyone needs to know about collegiate recovery, and you never know where that champion or that ally or, you know, advocate might come from, because you never know who's been, you know, who might be in recovery, who might have a family member in recovery or lost someone to addiction. But yeah, for us, it was really the folks within student affairs, the different student orgs, and then kind of going, you know, to the very top and trying to get it bought in, on kind of every level that we could.
Excellent. Well, that is all the questions that we have. Tim, I just want to thank you one more time for sharing with us today, and presenting more about the benefits of collegiate recovery, and how to gain buy-in on our campuses. I encourage all of you to connect with the Higher Education Center. You can visit our website, hecaod.osu.edu, or follow us on social media. Thank you once again, and we look forward to having you all joining us for our October 25th webinar focused on safe and drug-free campus policies. Have a great day.